There's a question many people wonder about, but rarely ask out loud. How long does it actually take for a woman to reach orgasm? It's one of those deeply personal topics that can feel wrapped in mystery, expectation, or even worry. But the truth is, understanding what's typical can bring so much reassurance and clarity to your intimate life. Well, I'm Dr. Nerea Wolf, urologist and pelvic surgeon, and if you ever have questions or concerns about sexual health, bladder wellness, or anything related to your urological health, stay with us. We're here to help you understand your body with clarity, compassion, and without judgment. Today, we're going to explore what science tells us about how long it takes women to reach climax and what influences that timeline. If you're new to this channel, I share urologic content twice a week, covering everything from bladder health to sexual wellness. If you find this helpful, please subscribe and share this with someone who might benefit from understanding their body a little better. Let's start by acknowledging something important. Every woman's body is different. The time it takes to reach orgasm varies widely from person to person, and that's completely normal. What works for one person may not work for another, and that's not a failure. It's just human variation. But we do have solid research that gives us a sense of what's typical, and understanding these averages can help remove some of the pressure or confusion that people feel about their own experiences. So how do researchers even study this? Well, they've done it in a few different ways. Some studies ask women to estimate how long it takes them to reach climax. Others have gone further and asked women to actually time their experiences with a stopwatch over several weeks. Yes, that sounds clinical, but it gives us real data we can learn from. One of the most comprehensive studies was conducted across the United States and Hungary. Researchers surveyed over 2,300 women, asking them about their sexual history, their typical experiences with arousal and orgasm, and any difficulties they faced. They asked about two different scenarios, reaching orgasm with a partner and reaching orgasm during masturbation. What did they find? During partnered sex, the average time to reach orgasm was about 14 minutes, but during masturbation, that time dropped to around 8 minutes. Now that's a significant difference, and it tells us something really important. Women often know exactly what their bodies need, and when they're in control of that stimulation, climax can happen more quickly. Why the difference? Well, there are a few reasons. First, during masturbation, women typically focus directly on clitoral stimulation, which is often the most reliable pathway to orgasm. If you've watched my video on female anatomy, you'll know that the clitoris is embryologically identical to the penis. It develops from the same tissue and has the same density of nerve endings. Just like most men need penile stimulation to orgasm, most women need clitoral stimulation. During partnered sex, the focus isn't always on the clitoris. Sometimes there's more emphasis on penetration, intimacy, connection, or pleasing a partner. And while all of those things are beautiful and important, they don't always provide the specific kind of stimulation that leads to orgasm. The researchers also noted that during masturbation, the focus is purely on pleasure. There's no distraction, no concern about how you look or whether your partner is satisfied. You're free to explore what feels good without any external pressure. But here's something equally important. Even though women orgasmed more quickly during masturbation, the majority still found partnered sex more satisfying overall. That tells us that satisfaction isn't just about speed. It's about connection, intimacy, trust, and shared experience. There were some other interesting findings, too. Women who experienced orgasmic difficulties were slightly less likely to find partnered sex as satisfying. About 44% did, compared to 75% of women without difficulties. And women who were older or in very satisfying relationships tended to reach orgasm more quickly. That makes sense, doesn't it? With age and experience comes better communication, a deeper understanding of your own body, and the confidence to express what you need. Now let's talk about what influences a woman's ability to reach orgasm and how long it takes. First, let's address the physical side. As I mentioned, the clitoris is the key to orgasm for most women. It's packed with thousands of nerve endings, and it's designed for pleasure. But the clitoris isn't just the small visible part you see at the top of the vulva. It actually extends internally, with wings that reach down along both sides of the vaginal opening. This internal structure means that even during penetrative sex, there can be indirect clitoral stimulation happening. However, for many women, indirect stimulation isn't enough. Direct focused clitoral touch, whether from fingers, a tongue, or a toy, is often necessary. And that's completely normal. In fact, in the 2020 study I mentioned earlier, which tracked 645 women across multiple countries, 69% of participants said they needed additional clitoral stimulation beyond penetration alone to reach orgasm. So if you're someone who doesn't orgasm from penetration alone, you're in the majority. And there's absolutely nothing wrong with that. Let's talk about timing. That same 2020 study found that it took somewhere between 6 and 20 minutes for women to reach climax during sex, with the average being about 13.4 minutes. Importantly, 17% of the women in the study reported never experiencing orgasm during partnered sex. That's a significant number, and it highlights the fact that orgasm isn't a given for everyone, and that's okay. Now, what affects how long it takes or whether it happens at all? Anxiety and depression were significant factors in the original study. Women dealing with mental health challenges often had more difficulty reaching orgasm. That makes sense when you think about it. Anxiety keeps you in your head, constantly monitoring and worrying, which takes you out of the moment. And depression can dampen arousal, desire, and sensitivity. Your brain is your most powerful sexual organ, and when it's struggling, your body feels it too. Relationship satisfaction also played a big role. Women in happy, trusting relationships tended to reach orgasm more easily. Why? Because they felt safe. They felt comfortable asking for what they needed. They weren't worried about being judged or rejected. Trust and emotional safety are foundational to sexual pleasure. Age and experience mattered too. Older women and those with more sexual experience often reached orgasm more quickly. This isn't about physical changes. It's about knowledge. The more you understand your own body, the better you can guide yourself and your partner toward what works. Communication is another huge factor. Women who can clearly express what feels good, what doesn't, and what they need are far more likely to have fulfilling sexual experiences. But many women feel hesitant or embarrassed to speak up. They worry about hurting their partner's feelings or seeming demanding. But good partners want to know what you enjoy. They want you to feel pleasure. And clear, kind communication makes that possible. Arousal and foreplay are essential too. Orgasm doesn't start at the moment of touch. It starts with arousal. The body needs time to respond. Blood flow increases to the genitals, natural lubrication begins, and sensitivity heightens. Rushing through this process can make orgasm much harder to achieve. Taking time with foreplay, building anticipation, and allowing your body to fully respond makes a world of difference. And let's not forget about clitoral anatomy and individual variation. Every woman's clitoris is slightly different in size, shape, and sensitivity. Some women are extremely sensitive and reach orgasm quickly. Others need more time and stronger stimulation. Neither is better or worse. They're just different. One more thing, medications can affect orgasm too. Certain antidepressants, particularly SSRIs, are known to delay or inhibit orgasm. If you're on medication and notice changes in your sexual response, talk to your doctor. There may be alternatives or strategies that can help. So, what can you do if you're struggling to reach orgasm, or if it's taking longer than you'd like? First, let me say this. There's no correct amount of time it should take. The research gives us averages, but averages don't define what's right for you. If you and your partner are happy, connected, and satisfied, then the timing is exactly what it should be. That said, if you're experiencing distress or frustration, there are steps you can take. Start with self-exploration. Masturbation isn't just about quick release. It's about learning. It's the best way to discover what kind of touch, pressure, rhythm, and speed work for you. Once you know what you enjoy, you can share that knowledge with a partner. Focus on clitoral stimulation. Whether it's during foreplay, during penetration, or both, make sure your clitoris is getting the attention it needs. Many women find that using their own hand or a small vibrator during sex helps them reach orgasm more easily. And that's not cheating. It's smart. Use lubrication. Good lubrication reduces friction, enhances sensation, and makes everything feel better. Even if you naturally produce some lubrication, adding more can make a noticeable difference. There's no shame in using lube. It's a tool for pleasure. Communicate with your partner. This can feel vulnerable, but it's so important. Let them know what feels good. Guide their hand, give feedback, and be specific. Most partners genuinely want to help you feel good. They just need to know how. Address anxiety and stress. If your mind is racing or you're worried about how long it's taking, try mindfulness techniques. Focus on the sensations in your body. Let go of the goal of orgasm and just focus on pleasure. Sometimes, removing the pressure to climax actually makes it easier to get there. Consider seeing a specialist. If you're dealing with persistent difficulty reaching orgasm, or if it's causing significant distress, talking to a urologist or a sex therapist can be incredibly helpful. There may be underlying medical or psychological factors that can be addressed. And if you're on medications that might be affecting your sexual response, don't hesitate to bring that up with your doctor. There are often alternative medications or strategies that can help. One last thing, if you've never experienced orgasm, you're not broken. Some women take longer to discover what works for them, and that's okay. It doesn't mean you can't enjoy intimacy, connection, and pleasure. Keep exploring, stay curious, and be patient with yourself. So, to bring it all together, research tells us that it takes most women somewhere between 8 and 14 minutes to reach O. Orgasm depending on the context. During masturbation, it's often quicker. During partnered sex, it can take a bit longer, but it's also often more emotionally satisfying. The key takeaway isn't about hitting a certain number. It's about understanding that every woman's body is unique, and what's normal for you might be different from what's normal for someone else. And that's perfectly fine. If you're struggling, remember, arousal takes time, communication matters, and focusing on pleasure rather than performance can change everything. Your body deserves kindness, patience, and curiosity. And if you ever feel lost or concerned, reaching out to a professional can open doors you didn't know were there. Thank you so much for being here today. If this video helped you, please share it with someone who might need to hear it. And remember, understanding your body isn't just about knowledge. It's about giving yourself permission to experience pleasure, connection, and joy. As always, take care of yourself because you're worth it.